Good morning and welcome. Thank you for joining us for another episode of House Calls, Real Docs, Real Talk. I'm your host, Sonia Azad. We've got a very special episode for you today discussing CPR. Now, the American Heart Association just released new CPR guidelines last week, and so we wanted to bring all the up-to-date information to you right here on House Calls as soon as possible. So the new guidelines issued provide science-based recommendations to maximize someone's chance of surviving cardiac arrest. Now, if you have a question about CPR, go to heart.org/house calls to submit your question, or just drop it in the comments during the show. And we're going to, of course, do our best to grab those and answer as many as we can. Look, we say this every week, but your involvement really is key to our show. So before we go any further, stop, hit that share button, maybe start a watch party. Let your friends and family know that you're watching this, and let's get those people involved as well. Also, throughout the show, we're going to ask you to get involved by answering a few viewer questions. So to respond, all you got to do is text AHA Live to 22333. We won't ask for your name or any information, just a fun and easy way to answer. And if you don't want to text in, you can also participate by simply dropping your answer in the comment section. So let's get started. With me this morning is Dr. Ashish Panchal, Professor of Emergency Medicine, Department of Emergency Medicine at The Ohio State University, Wexner Medical Center. Welcome, Doctor.
Thank you so much. It's great to be here.
Yeah, thank you so much for taking the time to be here with us. Before we begin, let's start with our first viewer response question. We want to know, have you ever had to administer CPR to a stranger or a loved one? Boy, what a question to start with. And Dr. Panchal, I haven't personally, but I'll tell you, if I did have to do this, I would want to know the proper way to do it.
Sure, definitely. Luckily for me, I've actually done it a number of times in my career as an emergency physician, but I've also done it both out of hospital and in hospital. So I've also done it as a citizen. And one of the things I can tell you right now is one of the things that made me so passionate about resuscitation research was to actually shake someone's hand who I did CPR on. And it was life-changing for me. And so one of the first things I can tell everybody right off the bat is push hard, call 911, push hard and fast.
Yeah, I think that's great information, great advice. As people are weighing in, most people are saying either no, they haven't had to administer CPR to a stranger or a loved one, or I have not, but would be comfortable doing it if the situation arises. So that is good news so far. So we're going to talk a whole lot more about CPR. Thanks to those of you who've weighed in already during our first question. And let's move on and get started with Health in the Headlines. So each week we select one current headline that ties back to the topic at hand and ask our expert to respond. So this week's entry comes to us from the Washington Post, and the title is "Coronavirus Fears Shouldn't Stop You from Using CPR If Someone Needs Help." Boy, what a topic. Dr. Panchal, can you update us on sort of CPR in the age of coronavirus?
Yeah, this is a great question because for me too and our family, it's scary. The potential that you can get infected by a virus is truly scary. Now, there's a couple of different things that I think really impact making this decision. So let's start with the basics. A lot of cardiac arrest events actually happen in the home. So these are your family members, your loved ones, your relatives, and you live with them. You're around them all the time. So chances are you're probably already exposed. So in those situations, perform hands-only CPR, push hard and fast, do the right things, save the life, right? So that's a pretty straightforward one. I think it gets tougher when we start thinking about a stranger in a public space. What do you do in those kind of situations? Now, there's a lot of research which is being done as we speak looking at this question because not all the answers are in. Now, what we do know is that in recent studies, when they've looked at individuals who've had cardiac arrest events, they've actually had a low number of these who actually have coronavirus. And a lot of that probably is due to the fact of what is causing the cardiac arrest event. With cardiac arrest, it's generally electronic malfunction and people suddenly collapse. Very different from someone who has coronavirus and the respiratory problems. So when all is said and done, when you think about that in the face that each minute without CPR delayed has an enormous impact on that individual's survival, putting it together, my recommendation is really just step forward, save the life, perform CPR without fear.
I think it's such a great point that you made that most of these events happen in the home, surrounded by people you know, because I think we all probably imagine the movie scenario, right? Where you're like walking down a street and somebody needs help, but that's not the case all the time.
Yeah, a lot of your family members, and especially with the holidays coming around, just keep watch over each other.
Yeah, certainly. Okay, we're going to get into our main segment with live viewer questions in You Ask, We Answer. And as a reminder, while we're talking today, you can submit your questions in the comments section, or you can submit them through heart.org/house calls. So let's get to it. Our first question comes to us from Lewis in Albuquerque. Lewis is asking, can you give us an overview of the biggest changes to the guidelines? Great place to start, Dr. Panchal.
Definitely, Lewis, thank you so much for the question. So the 2020 adult AHA guidelines and all the guidelines put together, we focused a rigorous evaluation and looked at all of resuscitation science to bring the best evidence so that we can put science into action. And we came up with 491 different recommendations. Of course, I'm not going to cover all of that today, but I do want to hit those highlights that you're asking about. And so one of the biggest highlights for me is reaffirming the cores of resuscitation. So that means early recognition, really getting people to recognize CPR and using that evidence that we have to help better identify when a person has a cardiac arrest event. Second, early high quality CPR, going back to what we just discussed a second ago about pushing hard and fast, also minimizing pauses. These are things which are key to saving a life. After that, early defibrillation. So bringing that AED and involving yourself in the resuscitation of the patient. And this can be done in the public space. Now, when we talk about our EMS professionals and our hospital providers, we reaffirm a lot of the key things that we need for cardiac resuscitation, specifically reaffirming the use of epinephrine since it improves survival for the patient. Now, one of the other big areas that I'm very excited about is we looked at all the data and we really recognize that not all cardiac arrest events are identical. So that means for some of these, you need specialized management. And in the guidelines, we provide new algorithms and new directions for these kind of situations. For example, things like opiate-associated cardiac arrest with the large opiate epidemic, as well as pregnancy-induced cardiac arrest. Now, the last thing, which is truthfully one of the most exciting things for me, is we added a link in the chain of survival. Now, the chain of survival is all the different pieces that are critical to reaching a great outcome for our patients. And that link is the recovery link. We've learned one big thing, that people do survive from cardiac arrest, and what we do in the field matters. And so the recovery link is directed at setting expectations and survivorship plans to optimize people's transition of care to home with their families.
All right, that was a great first question and answer. Thank you, Doctor. We've got another good one from Lily in Delaware who asks, I see a lot of different organizations in my city offering CPR training. Are they all the same?
That's a great question, Lily. Thank you so much. So when all is said and done, I think one of the key things that you need to do is be able to learn how to do CPR and do the motions and the psychomotor behavior, the brain and hand behavior of performing CPR. So really, any training is great. I really want you to get engaged in training. Now, with that being said, one of the things that I want you to do when you think about getting trained is think about the course and what the focus is. Find places where they're implementing evidence-based education and learning strategies. Now, the importance of this is that it optimizes your training time and your retention of knowledge. That's really critical. Now, one of the things with the American Heart Association courses, which I love, is that they're tied to international experts on resuscitation, many of which are my friends. I think that hearing their minds and seeing how that comes into the guidelines and seeing it filter down into the training, specifically on education and learning strategies, is key to making sure that you get the best learning experience that you could possibly get.
Now, Dr. Panchal, we've got a question from Eddie in Boston. Now, you had mentioned pressing hard and fast. His question is, I'm hesitant to give CPR to a woman. Could I hurt her?
Yeah, Eddie, that's a great question. And I think a lot of people struggle with this and not many people talk about it. So I'm so happy you brought it up. because we're even seeing it in our literature, that in the literature, it suggests that there is gender disparity when people are thinking about performing CPR. And so I guess the direction I want to give and kind of the framework I want to give is when we think of anyone who is a victim of cardiac arrest, we need to recognize one truth. Without CPR, they will probably not survive. And that means they won't be able to spend time with their family, their friends. And so that's the problem we should focus on. And so we have to perform CPR. Now, here is the good news for you, just to ease some of your fears. In this guideline, we did a rigorous evaluation of all the data associated with performing CPR and causing harm. And what we found is that the risk of harm from performing CPR is actually quite low. So you should feel comfortable and advocate for performing CPR.
Save the life.
Yes, definitely.
Yeah. Okay, let's get to one more before we get into our break. Gina is a mother living in Long Island. She just asked, is CPR different on a child versus an adult?
That's a great question, Gina. And actually, when we look at the guidelines is separated into adult sections and pediatric sections for the very reason that it is a little different. Now, and specifically, it's because of the causes of cardiac arrest. In children, when we think of the cause of cardiac arrest, it's generally due to a respiratory problem or a breathing problem. Now, in that sense, when we perform CPR on children, we want to perform compressions and breaths because the cause is oftentimes due to respiratory problems. Now, with adults, it's due to electronic malfunction of the heart. So one of the big things that we want to focus on there is not only performing the CPR, but getting something like an AED available so that we can shock the heart. Now, in adults, we've done tons of research looking at one fundamental question. Can we do hands-only CPR? Or do we need to do compressions and breaths? And the data is pretty clear that you can do hands-only CPR and get the same bang for the buck when you're doing compressions. So one of the things that's different for adults is you can do either hands-only CPR or compressions and breaths, or whatever you feel comfortable with. Now, one of the things I want to stress is these are challenging questions, especially for a mom like yourself. So this is a great reason to get out there and get trained. They will help you get comfortable and understand the limitations that you have with both approaches.
Okay, this is such a good discussion so far, but we want to take a quick break for another poll question and hear from our viewers. So all of you watching and listening, grab your phone, get ready to text in your answer. As a reminder, all you got to do is text AHA live to 22333. Now, if you've already registered, you don't need to do it again. Or perhaps if you're joining from your phone and it's easier, you can just drop the answer into the comments section. I'm watching the comments pour in today. Our question is, have you been trained in life-saving hands-only CPR? And we just started talking about this, just as effective.
Yeah, definitely. So when we think about hands-only versus compressions and breaths, hands-only CPR is just as effective. I love the fact that it engages the individual too. When you think of hands-only, you think of call 911, push hard and fast. It's really focused, something that you can do really easily, and you can be trained to do it very, very easily, especially throughout our communities.
I think it's just important to note where to press as well, right?
Right in the center of the chest. And the great part is it becomes, when you're in the midst of it, it almost is self-evident. Put your heel right in that center of the chest, right above the sternum, and you'll be good to go.
And as people, because I see that they're sort of still weighing in, a lot of folks are saying I need to get, recertified. Can I do it virtually? What is your suggestion or recommendation for that?
Definitely, if you're interested in training, definitely go get trained. You can definitely recertify. That's not a problem. Of course, feel free to watch videos online. So one of my research areas is, can videos of watching 1 minute CPR training from the AHA and things like that make an impact in learning? And it does. And so any way you can kind of engage in that training will be so critical for your family members. And here's the best part. With the holidays coming up, talk about it with your family. Like, even talking about it and raising awareness helps people's intention to perform CPR. All good things.
Yeah, and certainly we always see these cases rise around the holidays. Okay, so it looks like, the numbers are kind of shifting, but for the most part, most people are saying C, no, never, when it comes to being trained in life-saving hands-only CPR. So this is kind of a new one for folks, but one that's important, and maybe we'll get some eyeballs on some of those virtual trainings at the very least.
Sounds like a New Year's resolution.
Yeah, good idea. Okay, before we get back to the rest of your CPR questions, I've got a little surprise for y'all today. We've got a special guest. She's only going to be with us for a few minutes, but she has some really great information to share with you. So I'd like to introduce Dr. Rasha Alami, an AHA Scientific Sessions virtual co-pilot. All right, so with all the virtual events this year, the Sessions virtual co-pilots are your guides to the ultimate Scientific Sessions 2020 experience. They're going to share their personal itineraries, sessions recommendations, and will be actively engaging in live chat and on social media. Dr. Alami, thank you so much for joining us. It looks like you're in a hospital right now.
Thank you so much for having me. It's in the middle of the day here in London, so we're just in between operations.
Oh my gosh. So we won't take up much of your time. It sounds like you know a lot about Scientific Sessions. So give me the details, maybe your top 5 reasons why cardiovascular science and medical professionals should attend Scientific Sessions 2020.
Thank you. Well, I think it's been an unbelievably strange year for us all. And so I think my top 1 reason why we all need to get onto Scientific Sessions and really attend them is to have a sense of normality again, to be able to see some of our colleagues and our peers presenting, to be able to learn from the science again, and also to be able to remember just how important cardiovascular disease is. You know, we still need to be educating ourselves. We still need to be learning from cutting edge research. And I think one of the fantastic things about this year, and if I can have a positive from the pandemic, is that many, many people who would usually have to travel for the scientific congresses will be able to sit in their living rooms and really learn from the science without having to go all the way there to the Congress. Also, it means that we've got a fantastic lineup of speakers because, again, those speakers haven't had to travel, and the organizers have had their pick of the best speakers across the world. In terms of highlights for me, I can't wait to hear from the late breaking science sessions. There are some fantastic trials out there. So for those physicians and patients in the audience, the Samson trial is really one to watch because that's a real life statin side effects trial, trying to work out whether statins really cause the side effects that some patients fear that they do. We also have some fantastic trials in terms of CT choreangiography. The rapid CTCA trial tells us what we should do with our acute patients and whether they should be having a CT choreangiogram in the emergency room. So I think it's going to be a fantastic year, and I'm really looking forward to it.
Well, Dr. Alami, thank you so much for sharing that with us. And I hope you get lots of people that follow along your journey. We'll let you get back to your work right now, to those patients who need you. Thank you so much.
Thanks so much for having me.
And remember, you guys, Scientific Sessions is November 13th through 17th. Registration is open, so go register today. Okay, let's get back to the topic at hand and address a few more viewer questions on CPR. So here's one from Myra in Lexington, Kentucky. Myra asks, is cardiac arrest the same as heart attack? And do I perform CPR either way? Okay, Dr. Panchal, as a health reporter, health journalists always are talking about this, how to write and how to explain this to people. So it's all yours.
Oh, no problem. So I think this is really challenging myself because I think it's a hard distinction because they both sound so similar, but they are very different. So when we think of a heart attack, that's when a blocked artery is preventing oxygen-rich blood from reaching a part of the heart. Now, if that blocked artery is not reopened quickly, that part of the heart normally nourished by that artery begins to die. So the longer a person goes without that treatment, the greater the damage. Now, when we think of the classic presentation, we think of the individual grabbing their chest and saying, oh, I have chest pain. That would be that classic heart attack type picture. Now, when we think of a cardiac arrest, focus on that word arrest. That means something is stopped, okay? So cardiac arrest occurs suddenly, often without any warning. It is triggered by an electrical malfunction in the heart that causes an irregular heartbeat or an arrhythmia. Now, when this irregularity happens, what ends up happening now is the pumping action of the heart stops. So there's no blood being pumped to the brain, the lungs, or any other organs. So seconds later, after this happens, the person loses consciousness and has no pulse. Now, here's the key thing. Death occurs within minutes if the victim does not receive treatment. So that cardiac arrest event, that stopping of the heart event, needs CPR so that you can provide some support for this patient so that they can get their heartbeat back.
I think that was an excellent distinction. I just want to, before the next question, Rob is asking, can the speaker see these comments or is this recorded? We're live, Rob, so this is not recorded. Colleen from Arlington wonders, and this is another good question, what if the person has an ICD or a pacemaker? That's nothing you would see or even know.
Yeah, no, that's great that you brought that up. And more often than not, we don't stress over whether or not they have a device. And I love that you asked that question because you're thinking, am I messing something up along the way? And so what I want you to focus on here is if someone appears in cardiac arrest, that means that they're not responsive and not breathing normally. Our focus is going to be call 911 and start CPR, right? So it doesn't matter if they have an ICD or a pacemaker. In truth, it is all about what their presentation is at the moment. So if they are not responsive and not breathing normally, call 911, push hard and fast. Now, one of the things about these devices that is good is that they rarely malfunction. They do a really good job. Like the ICD's job is exactly what we want it to do, which is to shock the heart back into a normal rhythm from a life-threatening rhythm, things that would cause a cardiac arrest event. Now, the pacemaker doesn't do the same thing. It paces your heart. So it's not going to be able to do the things that you want it to do. So don't worry about looking for that AICD or that pacemaker. Again, focus on what the person's looking like and what they need at the moment.
Gonzalo from McAllen, Texas asks, can I be held liable for performing CPR?
Gonzalo, that is an amazing question because I think this is something a lot of people struggle with. So I'm gonna cut to the chase and give you a quick little answer on this. You do not need to fear performing CPR for any type of libel or litigation. So when someone is in cardiac arrest, we know they're about to die, right? Or they're already dead without any CPR. The good news is that if you perform CPR, you are well protected, and you're protected by the Good Samaritan laws. And these laws are in all 50 states, right? So you are well protected as a Good Samaritan, doing something to salvage a horrible situation. Now, with that being said, one of the key things that you have to remember about these cardiac arrest events is, again, you're not going to cause harm. Number two, you're not going to be held liable because you're doing what's right. You're trying to help someone out. And third, there is tons and tons of evidence, great evidence and great supporting people that show that it is very reasonable to perform CPR on somebody who has a cardiac arrest event. So you should not have any fear.
Save the life once again.
Yes, definitely.
Okay, our final question, and a lot of people are asking it, so I wanted to make sure to highlight it. Jane just asked, we're in the middle of a pandemic, and I worry about what precautions I would need to take to stay safe should I need to perform CPR. Do I have to perform breaths with CPR? Let's address this one more time.
No, I'm happy you brought it up again because, I mean, just to close the loop on this whole conversation, I think it's really important to discuss this. So with the pandemic, one of the things that all of us are doing, especially when we're out in public, is we're wearing our masks. And that is fundamentally the protection you need if somebody is having an event. Now, let's go back to what we were talking about a little earlier about family members and strangers. So if you're at home and someone has a cardiac arrest event, I think we all recognize that we're probably exposed. And so doing everything, doing chest compressions, doing breaths, you're just do what you need to do to save that life. In the public space, which is where we're a little more concerned, when we're in that public space, the data that we've seen so far is that you are pretty safe doing CPR for patients. Now, with the adult population, you can do hands-only CPR, and that's completely okay. It's when we think about kids where we're thinking, okay, I need to do compressions and breaths. And I think all of us agree, if a child is having a cardiac arrest event in front of us, we are going to do what we need to do to save that child's life. And so I hope that gives you a little bit of direction. Don't be afraid. Do what's right and save that life.
All right, Dr. Panchal, stand by because up next, it's our brand new segment called Triple Trivia. And Triple Trivia is sponsored by Crazy Cool Science, our new social media campaign that pumps up the fun in science. You know, science is everywhere, and Crazy Cool Science proves it. So we've got 3 trivia questions lined up to test your scientific knowledge. Today's trivia focuses on CPR. So drop your answer in the comment section or text in with your answer, and we're going to find out who's on their game today, who's really on their game. Okay, here is the first trivia question. When performing CPR, what is the rate of compressions you should do per minute? You know, what's funny about this is I actually learned this from the American Heart Association. There's a song that's usually associated with the rate of compressions.
Yeah, definitely. I mean, it's Staying Alive is one of the classic ones, but there's actually a video where you can find all these different songs, because I know I'm a little dated with Staying Alive. So definitely, you Staying Alive will get you there. You're at compressions per minute of 100 to 120.
Okay, so 100 to 120, those of you who guessed that one, you are correct. Yeah, I also heard, I think last year from the AHA, that there's a Beyonce tune that goes along with that, you know, for the updated folks, but I too am with you, Doc. Staying Alive works for me.
Yeah, no, totally.
Okay, our next question. In the new CPR guidelines, what does the new 6th link in the chain of survival address?
I am so happy you brought that back up again. We talked about it a little briefly. Is the 6th link of the chain of survival is recovery. So one of the big things about the chains of survival, we talk about this chain. Each of the chains are the critical aspects of what needs to be done for someone to survive. In these guidelines, when our experts got together, we recognized that we have so many survivors that we need to focus specific attention on their recovery. And that means making survivorship plans so that they can make the best transition to home and make the best transition to full functional recovery.
Okay, so recovery is the right answer there. For those of you who guessed A, recovery from a cardiac arrest, you got it. All right, our last trivia question for the day. Do the 2020 guidelines include any changes for bystanders? Yes or no? This is a simple yes or no question. Doc?
Yeah, so the bystander things are actually updated. So you're seeing a lot of good updates to the changes for the bystanders. So I'm going to say a yes here. So for bystanders, some of the big focuses are, of course, doing high quality CPR, doing all those things, pushing hard and fast, recognizing that a cardiac arrest event has happened. And the other thing is to use your mobile devices. Use these kind of mobile devices to keep talking to your telecommunicators or your dispatchers on the phone. And mobile devices can also be used for calling you to a cardiac arrest event. So lots of neat, different new changes there are in the guidelines.
Yeah, I loved from my CPR training learning, you got to go, you call 911, you grab the AED, right? And then you keep in contact with the person and those people. It's truly an orchestrated effort.
Well said. Yeah, because that speakerphone is a beautiful thing.
Yeah, absolutely. Hey, that's it for trivia. Thank you guys for joining in on the fun, and I hope we've all learned something new from it as well. Dr. Panchal, thank you for sharing the new CPR guidelines with us. I think we're all certainly better equipped to save a life after watching the show and hearing from you. Any final thoughts before leaving us today?
No, thank you so much for having me, and thank you so much for the questions. You guys are definitely challenging me, so I appreciate that. I guess my biggest comments are kind of circling around to the beginning. Like, one of the most amazing things I've had in my life was shaking that hand of a survivor. So for all of you out there, keep in mind that survivors are real, and people do survive cardiac arrest, and it's all about us being engaged and doing the right thing and just getting in there, and even in doubt, call 911 and push hard and fast. You will save a life.
Well, remember that. Dr. Panchal, thank you so much for being with us today.
My pleasure.
And as always, y'all, we are rounding out our show with a fun health hack. This week, Health Hacks is brought to you by One Cycle Nation. The event that we've been talking about is this Thursday, October 29th. So I hope you've already registered, but if you haven't, go to heart.org/Cycle Nation. This Thursday, there will be a special live show. The event's going to feature Olympian Michael Johnson and actor Timothy let me say this name right, Amundsen, best known for his roles on Supernatural, Psych, Gallivant, and of course, This Is Us. We've got a special little video. Oh, the event is going to be live streamed. Let me mention that on AHA channel, so no excuses. Check out this video now for a sneak peek.
I would think if you're having a stroke, you probably know it when it's happening, but you don't.
The day I actually had the stroke, I was in an airport trying to get back to LA. My left hand cramped up and it wouldn't move.
My first question was, will I be able to recover?
Then I eventually had a craniectomy, so where they took off half my skull so my brain could swell.
Now it's more minimize my risk of a stroke and live my life.
All right, now for the health hack. This week's hack comes to us from Sam in Albuquerque. He's got some quick tips to get more out of your exercise routine. He says while doing planks, alternate raising one leg, then the other, a few inches off the floor to make it harder. Make push-ups a challenge by placing your feet on a bench or a chair instead of the floor. Wow, Sam, you are really bringing it. That is hardcore. Thank you. Remember, we feature a new tip every week. So if you've got a great idea, you can send it to us at heart.org/housecalls. Maybe you'll see your idea live on the show. That does it for our show today. Thank you so much for joining us. Remember, you can find any of our previous shows at heart.org/housecalls. And don't forget, since there are always so many more questions than we have time to answer live, you'll find answers to anything we didn't get to today on the House Calls After Show. So look for that Thursday on the American Heart Association YouTube channel. Thanks so much for tuning in with me this morning. I'm Sonia Azad. We'll see you back here next Monday.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.